All right. So just again, a warm welcome to today's webinar, and just some background to why we're here, who is we. So we're the Global Healthy Hospital Food Network, and I'm very glad that you're joining our webinar series today. The Global Healthy Hospital Food Network is an initiative that has been launched this year. So we're quite young still, so to say. And with our initiative, we want to aim to transform hospital food services worldwide with the aim to prioritize health and sustainability within those food services. The network is a collaborative effort between the four founding partner organizations, which is the Physicians Association for Nutrition International, ProVeg International, Greener by Default, and the Plant-Based Health Professionals UK. So we're spanning regions just from the founding members from the US, the European Union, including also the UK. So that's really great. And so far on our platform, there's a digital platform, and I will share details on how you can join it as well just in a second. It's called Panko, and just within our space here for the Healthy Hospital Food Network, we already have 75 members, with the largest group being members from the UK, and then followed by Germany and South Africa. And in total, we already cover 18 countries. So I think that's really amazing to see how international the group already is. So I think that's really great. Having already 18 countries so far with very different perspectives on hospital food country by country. Also, in terms of professions, there's a broad range of interdisciplinary backgrounds. So just to name a few, we have dietitians, we have CEOs, family physicians, medical doctors, surgeons, PhD researchers and consultants. So it's a very diverse group, and a chef as well so far. So that's really great. And about 50% directly also work in hospitals. So I think we can really say that we have a good, a very, very nice base for this network. And I'm really happy if we can see it grow within the next weeks and months as well. So if you have people in mind that could also be interested, please invite them. I will share the details in a second. Okay, and without further ado, we really want to warmly welcome Dr. Robert Graham. And today we want to explore the intersection of food, health, and patient care. Robert Graham, he's a very special, comes with a very special background. So he's a medical doctor and a chef at the same time. So he's one of the many, of the very few, doctor chefs worldwide, and a trailblazer in culinary medicine. Dr. Graham is a Harvard-trained physician, board certified in internal and integrative medicine. He redefines healthcare by integrating food into the prescription pad. As the co-founder of FreshMed New York City and chief health officer at Performance Kitchen, Food is Medicine, he's leading the charge to bring a food-first approach into chronic disease prevention and management, and transforming outcomes in the process. So listen to our talk, A Food for Health Manifesto by a Doctor and a Chef. Please take it away, Robert. You can also share your slides.
Awesome. Well, thank you so much for that generous introduction. And it's always good to see some familiar names and obviously make new friends in the journey that we're about to embark. So as I mentioned, I'm calling this a manifesto, partly because I think we all have to agree on what the goals of what we're trying to achieve here. And without writing it out, it doesn't often exist. So I just want to obviously salute the work that Pan has done. And at the end, I'm going to sort of highlight who we should be watching because there is a lot of movement in this space. So with that, I will proceed with my talk here. So let me start off by saying that a manifesto is a written statement declaring publicly the intentions, motives, or views of its user, of its insurer. Sorry. And so I had borrowed this and reformalized a little bit what I wanted to talk to you about today. But really, it's a manifesto of food for health. We often hear the word food is medicine, food is nutrition, but I want to focus on a broader concept about food for health. When it comes to this, it aims to give voice, hope, and future to all those who wish to commit themselves to act and consume in keeping with a sustainable food for health paradigm. I'll be discussing with you a little bit in my talk a little bit of my journey, and then again, highlight some of the work that has been done both in the US and abroad. Second, intended to be used as a tool to help mobilize the urgent transition to local, ecological, and diverse food systems within our health systems. Lastly, assert that health must be the organizing principle and aims to create convergence between all stakeholders for a common vision of sustainable development in line with the Sustainable Development Goals set by the UN. And just to refresh everyone understanding what these SDGs are, as you can imagine, there are multiple, 17, and so many of them cross this intersection between health and society and sustainability. And so for today, the goal is really simple. To connect the dots between food and nutrition, I don't think anyone in this audience here needs to have a overcomplication of that issue. I think we all meet there. Offer practical examples how the kitchen training for hospital works. Share some examples of the case in New York. I'm going to highlight some of the incredible work that Greener by Default has done in conjunction with the city. And last, which is sort of a missing ingredient, I call, in this entire movement, and part of the reason why I did become a chef, is really to promote the role of chefs in food transformation and healthcare. And so I'm going to give it a little bit of an example of where we were about 60 to 80 years ago. So if you remember the tobacco movement of the 1950s to the 1990s, where physicians were actually proudly recommending and promoting cigarette smoking. And if you look at the bottom here, your throat protection against irritation, against cough. And so if you would smoke a Lucky Strike, your throat would feel better because it's toasted. And this is just an understanding of where medicine was and who were the promoters, the influencers, if you want to call it, of tobaccos back in the 1950s, doctors. Can you imagine going to a doctor's office and seeing him smoke in today's world? I just got off a plane 2 days ago, and I just can't imagine, I was putting the slides together of smoking in airplanes, but I would imagine some of us in the audience remember those days where you actually can smoke on an airplane. And so using that as a frame of reference, shouldn't we also be sort of out banning this sort of junk food in our hospitals, as well as imagine our school systems? I consider some of these junk foods just as toxic as cigarette smoking. And in fact, processed foods have been declared a class 1 carcinogen. And so here we are in our hospitals. And if it really is truly a place of healing, why are we feeding our patients the junk that brought them in the hospital in the first place? And I spent a lot of my career trying to educate patients and doctors and physicians and CEOs of hospitals to make that shift. But one of the things I learned in culinary school, the reason why food tastes so good, particularly if a chef makes it, it is typically high in fat, salt, and sugar. Now, are these necessarily bad? Maybe not, but we should actually be modifying them into a health profile within our health systems. And in fact, as you all know here, dietary risks, this is a Mochad study published in 2018, that dietary risks overtook tobacco use as the #1 risk factor for related deaths. And in fact, if someone asked me once recently, what is the worst food you can have? And in fact, ultra-processed foods now are the leading cause of early death, warns a BBC doctor. Again, here I just want to shout out some of the amazing work that the UK has been doing. And I think we can learn a lot of what they've been able to achieve. And again, looking at big food like we did big tobacco, I think is a very simple way of how we can go forward. And in fact, in the US in 2003, the diet is the #1 cause of death and disability here in the US. Globally, 22% of global deaths are due to a poor diet. So this is not necessarily just an American thing. It is slowly becoming a global thing. And so again, this is the transition I want to make here today with all of you. That if we look through the 1950s and 80s, it was not uncommon for hospitals to have smoke cigarettes on their campuses. And it wasn't until the 1990s, and this is going to become important as I share with you some of my history in this movement. It wasn't until the campus-free policies of the 1990s where it transformed healthcare environments, basically outlawing or banning the use of tobacco in our hospitals. And I think healthcare policies could do the same thing for diet-related illnesses, giving patients, their loved ones, and people that work within our hospitals access to fresh, nutritious foods that support health. And I think all of us here are looking at a common goal. If governments and healthcare sectors globally are really committed to the food that the idea that food is medicine, then they need to start improving food served in hospitals and healthcare settings. And so just let me start by just telling you a little bit about me. So I've been a medical physician for over 20 years as a medical doctor. I am trained in internal integrative medicine, but trained also in holistic and functional medicine. I am considered one of the founders of culinary medicine. I am a chef, as Evelyn mentioned, and we established the first rooftop garden on a hospital to prove this idea that if we actually grow our own food, we're able to sort of provide the patients in our hospitals healthier foods. I have a master's in public health. I'm a reformed health services researcher and food activist. And we did start a company after about 20 years of practicing medicine within a large conventional health setting called Fresh Medicine, because we believe medicine needs a fresh start, and it starts with food. And so I can never tell you about my history without going back to these two amazing people. These are my parents. My father is a biochemist or retired biochemist and a farmer from Washington State. My mother is a stay-at-home mom, cooked all our meals, scratch cook all our meals, and really was the foundation of culinary medicine to me. She had this belief that if you eat right, you live right. And together, they sort of formulated my concept of bringing both conventional biological medicine with more alternative or holistic approaches to healthcare. My mother is from El Salvador and considered a folk healer within her neighborhood. And this is sort of the food that she would create. This is, of course, Thanksgiving, but was always fascinating to me, reflecting back on my youth, of how my mother, at the age of 40, developed this crippling arthritis, but yet felt that her love language was food and would provide for us 3 cooked meals every single day. And I like to say that she's 85 years old now. And so this sort of concept of bringing me back to my roots, how my mother cared for us, how she loved us, and how she thought food was medicine. I think in today's world, it is clear that healthcare does need a fresh start, and it should start with food. And so throughout my career, I had this idea. What if I started writing prescription pads on my prescription pads for patients to eat healthy foods? This sort of evolved into what they called food and vegetable vouchers here in the US, where you can redeem a doctor's prescription for healthy produce, and in some instances covered by insurance. I will wrap this all up at the end by talking about where the food as medicine movement is in the US today. And again, in 2010, we started the first Cooking with Doctors program, which evolved into a movement called culinary medicine. I like to be considered one of the fathers, partly because I had this idea that if we took doctors out of hospitals and into true culinary schools, we were actually going to be able to leverage the power of my mother, the power of a cook or a chef in working with us as part of the actually healthcare team. And then again, this was called Teaching Healthy Ways to Doctors in the Kitchen. And one of the fathers, also considered John LaPuma, calls culinary medicine is a new evidence-based field in medicine that blends the art of food and cooking with the science of medicine. And a lot of the work that we've been doing here with PON and others, I have felt that for the past 15 years that we may be focusing on the wrong audience. Now, doctors should learn about nutrition, should learn about whole food plant-based diet and therapeutic diet, but really translating that knowledge into the patient in that clinical room with that 15-minute visit, maybe engaging with the food service providers and chefs may be the better answer if we're going to change healthcare from within the kitchen. And again, just want to state here, culinary medicine is an emerging field that integrates the science of medicine and nutrition into the art and science of cooking. It is designed to help chefs, culinary professionals, health professionals, and food enthusiasts create meals that not only taste great, but also promote health and well-being. And so these are some of the pictures I'd like to share of some of my classes that I've been doing twice a year since 2010. And as you can see, the problem we have in our society today is that many of our hospital foods that we serve our patients is junk food. And in fact, 1 in 5 hospitals have a fast food restaurant. Now, some people could argue that maybe that's better. A Burger King or a McDonald's is better than some of the food that we serve our patients globally. And so when you think about how do we prepare our foods, it's really not at the level of a registered dietitian or a physician. It's really at the level of a chef. And I'm going to share with you a little bit of the work I did when I was with North Shore LIJ. This becomes important because this is sort of was my testing center. So these are all the chefs within the hospitals that made up North Shore LIJ. As you can see here, the man in white with the chef jacket and the apron is my chef mentor, Chef La Marita from the Natural Gourmet Institute. He has over 35 years of culinary experience. And really took me under his wing. And as you can see, this is the day that I decided to become a chef because I was the only one not wearing a chef jacket. And part of the problem that we have in healthcare today is talking about sustainability, that 70% of hospital food is wasted. If anyone in the audience is very interested in this field, it is very hard to capture total food waste in our hospitals. Not because it's hard technically, it's part of the actually dirty little secret. Our hospitals spend a lot of money on food that is not eaten and thus wasted. And I think if we actually can capture the waste, we can actually save money by reducing the amount of wasted food that we have in our hospitals. And some of the work that I've been able to do, as well as some of the colleagues here on this presentation, have been shown to reduce food waste and increase the quality of our food. So therefore, more people eat our food and not throw it out. And as some of you may have heard, this became my passion once my father-in-law, who died at the age of 65 from a reversible disease called esophageal cancer. And for me, admitting him to one of the leading cancer institutes and having him fed a processed lunch meat with Jello and ginger ale was the last I can imagine. So if we are truly a healthcare system, the first thing we should be doing is introducing healthy foods in our hospitals. And because of the time that we had this idea back in the early 2010s, 2013, it was still sort of revolutionary and somewhat controversial. But one of the things that if you remember what I said before, in the 1990s, there was a tobacco-free campus bill put out in New York. Basically meant that you cannot smoke in public places. And this was the rooftop on a hospital called Lenox Hill Hospital, which where I trained and then subsequently worked. And what we did, it turned this abandoned rooftop into an edible garden where people can actually join, commune, as well as feed themselves. And we grew fruits and vegetables, all organic, based upon the cultures and society and ethnicities of our healthcare workers. So that's why you see different types of pepper, different types of lettuces, different types of herbs. And it wasn't until the chef that really understood the principles of healthy eating, particularly using the freshest and locals ingredients. And no, we did not switch over to an Eat Lancet diet, 80-20, but we were able to start introducing Meatless Mondays back in 2012 as an idea, working with the Monday campaigns on how to introduce healthy, nutritious, local, plant-based options, meat-less meals on Monday. And really was the chef from Sodexo that made that first leap in 2012. And before I left in 2016, over 20,000 people visited Victory Gardens. And the hashtag still lives today. Landed me on a TED stage where I shared some of the work that we started doing at Northwell. Northwell grew out of North Shore LIJ, the system that I had worked for, that picture of all the chefs. And during the 2015 to 2016, the quality of inpatient food rating. As you can see here, it was the lowest at 9%. In fact, it was a little lower in 2015, about 3%. And with some of the changes I will share with you from 2016 to 2021, and now today, it has gone up to a patient satisfaction for the quality of food that they prescribe at Northwell, Lenox Hill Hospital, now over 95%. So a true testament to the concept and the execution of these ideas, that if we are able to change how we purchase, procure, and cook our food by engaging chefs, the quality of our food grows tremendously. Again, increase the quality, decrease the cost. Again, it was so popular that it was published in 2018 in the New York Times. And as you can see here from a comparison from some of the slides I showed you about what hospital food looked like traditionally to these fresh, local, beautiful things that oftentimes are actually delivered by the chefs in the hospitals of Northwell. And in 2021, when my dear friend Eric Adams became mayor, he had spent 6 years at, I believe 6 years, as a Brooklyn Borough president in Brooklyn. And that's where our relationship started. And when he sort of became the mayor of New York, he elected a couple people to be part of his transition team, and I had the proud honor of being part of his institutional food system. And during that time, and assessed this in 2025 by his deputy secretary, Rachel Asterson. And these are sort of the steps in how what we did at Northwell, but also what was able to be done at New York City Health and Hospitals. And I would just want to, again, tip my hat off to the amazing work by Heidi and her team at Greener by Default, which I will share a little later. So again, getting stakeholder involvement is very important. Writing a true mission vision is highly important, and also putting a timeline with identifying research and outcomes development programs. And then the fifth part is really engaging not only the patients, but everyone involved in the steps. And then step 6 is designing a program, and then again, tracking the results and trending the progress. And so I'm just going to share with you some of the work that was done here in New York City. Again, during his time as Brooklyn Borough President, Eric Adams asked hospitals to sign a Meatless Monday pledge. As I mentioned before, in 2010, we started started that idea within Catholic Health, Northwell. And then New York City Health and Hospitals President, Dr. Katz, made the pledge that the system would work with dining services partner Sodexo to begin offering plant-based meals each Monday. So the idea there was the Brooklyn Borough President started something, again, moved into a health system just on Mondays, and because of the quality of the meals that were prepared, all plant-based meals proved to be very popular, with the average of 97 patients preferring to eat a plant-based diet every Monday. So again, the way this works is engaging, but also collaborating with the chefs. And I really believe that the pivotal factor here within the New York health systems was the hiring of an executive chef, a friend of mine who really stood behind the principles of culinary medicine and food as medicine, and then implemented a centralized kitchen. Part of the challenge some of these kitchens have is that they're providing meals for the hospital right now the way they currently do it. But to introduce a new model, sometimes the meal production has to be taken off-site and then brought in until the kitchen is ready to make that shift. So again, a learning lesson there as well. But the amazing part about this whole movement is that, again, it continues to grow, it continues to be very popular, and scores have remained above 95% for plant-based options. But also really important in the context of sustainability is that when comparing animal protein entrees to plant-based protein entrees, they were able to save 59 cents per tray. So again, working on a supply chain issue there. Since implementing plant-based dining's decrease in carbon dioxide emissions for overall purchase by 36%. So oftentimes I hear, well, how did anyone ever do this? And I just want to, again, shout out to the Greener by Default, again, expanded partnerships with Sodexo to offer plant-based meals at 400 US hospitals. Let me repeat that again. 400 US hospitals in the US will be partnering with by Greener Default to offer plant-based meals. Again, a kudo, it's oftentimes reflecting on the journey for the past 20 years. This is truly a successful movement that's happening in front of our eyes. And I think I would argue with everyone here that, you know, having the doctors and dietitians is such an important in terms of promoting and engaging healthcare systems. But what I have found through the lens of being a chef, not necessarily the doctor, is that many cooks or food service people in our hospitals want to start cooking again and not just reheating. They want to cook local, sustainable, seasonable ingredients and really make an impact into healthcare. And I'm going to be sharing with you some of the work that has been done throughout the country as well as the world. And again, if you ever heard me speak before, this is my favorite quote, Wendell Berry. This is why I do what I do. Because people are fed by a food industry which pays no attention to health and are treated by a health industry which pays no attention to food. Now, I'm going to share with you a little bit of background here because I want you guys to understand why I'm focusing on the chefs, the food service industry. Particularly, who would ever thought in a talk about food and health, I'll be talking about France. But I think we all have heard about this French paradox, that France has the highest rates of saturated intake, but yet the lowest rates of heart disease. Now, why would that happen? Now, there's a couple some competing theories on this, but one of the things I like to say is that, number one, They limit the amount of the portions, number one. Number two, it's how it's made. And the home of the croissant, who would ever thought it would be the home of the word restaurant? The word restaurant comes from the verb called to restore, to refresh. And in fact, when you go back into the literature in 1765 in Paris, it was the first time that rich broth, bone broth, if oftentimes considered, or chicken noodle soup, it's a lot of the collagenase or the glutamine that you find in bone broth that is often considered healthfully to restore someone back to health. Not necessarily saying that bone broth is the healthiest thing, but if you go across all countries and all states, there's often a broth that heals people back to health. And in fact, this is sort of the beginning of the word restaurant, which again means to restore. And again, this is sort of a picture of a bone broth. And one of the things I like to say, in 1825, not a physician, but a philosopher of taste wrote that the destiny of our nations depends on the manner in which they feed each other. And this is sort of his amazing book, The Philosophy of Taste. And again, it doesn't just talk about the relationship between health, but also the experience of eating. It goes beyond just recipes and culinary instructions, and it really dives into the cultural, social, and philosophical aspects around food, presenting food as central, an essential part of human life. And again, changing the narrative from the doctor telling them what the patients have to eat, but then exploring your ethnicities, your culture, and why we eat what we eat. And again, I like to sort of highlight a couple of chefs that really have pioneered and really have formalized my focus on healthy eating, not necessarily as a physician, but really on cuisine. And so this is Michel Guérard. He's one of the fathers of what they call Nouvelle Cuisine, a movement that revolutionized French cooking in the 1960s. So going from the very sort of traditional French culinary techniques to a lighter, less heavy style of cooking, emphasizing freshness and simplicity, he also pioneered what we called cuisine monsieur, a low-fat, low-calorie approach to nouvelle cuisine. So this is where the chef started taking action and started developing foods that we would now consider food as medicine. And again, this didn't necessarily happen in a hospital. And what we're seeing today in the longevity movement, if you haven't been abreast of it, and travel tourism, what we're finding out a lot is what I think he started, that introduced someone who was traveling, going on a trip or a vacation or a holiday, but surrounding themselves in wellness, starting with food. And as some of you may know, I work with the Amman Hotel here in New York, and this is sort of the idea there, is that you bring in a chef and a doctor that can prescribe healthy, delicious, sustainable, spa-like meals for patients who are experiencing wellness. And I think the movement we should be seeing in today's healthcare system is that hospitals should be a place of hospitality that is grounded on healthy eating, but also understanding the principles of meditation, mindfulness, and other modalities that have been sort of put to the side of healthcare, but front and center when you come to a spa. Simply because let food be thy medicine and medicine be thy food. And I often say that we often hear that food is medicine, but cooking is medicine. And research has shown that societies and countries that cook more suffer less heart disease and or obesity. So in fact, I consider cooking as medicine. And then if you don't believe me, believe Michael Pollan, one of the greatest journalists and food journalists ever. The most important thing you can do with your health is to cook. Cooking is more powerful than any medication. The problem we have in our society today, people don't have the time, skill, or money to cook. I'm speaking more from the US perspective, because my travels through the Netherlands and Italy, cooking is still a very sort of principles of healthcare in many homes. But as people are starting to cook less, our health is also declining. And so I've always believed that by understanding the relationship between food and health, chefs can use their skills to address dietary needs, prevent disease, and enhance the quality of life through food. So some of the work that I've been embarking on in the last, say, 5 years is really continuing to teach doctors and dietitians the principles of culinary medicine, but really now focusing on food service providers and patients who want to cook. As chefs, I believe we hold the responsibility for harnessing the power of food to nourish not just appetites, but bodies, minds, and communities. Through our culinary expertise, chefs have the power to transform ingredients into potent prescriptions and health for food systems transformation. And again, we are all here that our food is killing us. And again, equally important, in today's world, a myriad of crises are impacting our food system and our health. Understanding the role of food as medicine is more crucial than ever. Each meal, I believe, presents an opportunity to support our health or undermine it, highlighting the importance of food and promoting overall well-being. Again, I am just a new messenger of a very old story. When diet is wrong, medicine is of no use. When diet is correct, medicine is of no need. And again, this is sort of an Ayurvedic proverb. Now, let me share with you a couple of practical steps that I'm starting to put together on how to integrate the chef perspective into culinary medicine. Again, I have spent almost my entire career educating doctors, dietitians, as well as patients on how to cook more healthfully. And oftentimes, patients are just simply confused. And so what if we go right to the source, the cook, the chef? And again, in culinary school, we learn many different methods of cooking, but highlighting how food is prepared and cooked can significantly increase the effect of its nutritional value. Steaming, grilling, roasting, sauteing, and healthy fats like olive oil can preserve the power of the vegetables that are recooking. And again, optimizing cooking methods to retain nutrients and avoid harmful effects. So, cooking, first part of the course. Second, I believe that chefs don't have to become dietitians, but should have an understanding of the basic concept of how food affects the body and help create more health-conscious menus, like a gut health menu, a cardiometabolic health menu, an anti-inflammatory menu. And I can tell you this from firsthand experience after 15 years of teaching doctors. Chefs are so interested in this, partly because of how the movement is happening in the globe, throughout our globe, that people are choosing more healthful diets. And again, the concept of functional foods, again, chefs shouldn't have to be experts at it, but understand that certain compounds have specific therapeutic effects, like antioxidants found in our fruits and vegetables, omega-3 fatty acids from nuts, from seeds, and some fish, fermented foods, sulforaphane found in broccoli. All of these things, understanding these principles of functional foods can help chefs design dishes that can help prevent chronic diseases like I mentioned before, heart disease, diabetes, and obesity. Again, experimenting. One of the things I can tell you about chefs is that we love to experiment with ingredients. Start incorporating herbs that are outside of your spice box, I think, is very important. Adding turmeric to soups and smoothies, incorporating dark leafy green vegetables like spinach into salad and stir fries. Some of these principles haven't been taught to our food service professionals, and I think reconnecting with them, particularly when it comes to our cultures, is so important. Again, highlighting a little bit of the functional foods that we should be cooking more with: turmeric, ginger, garlic. And again, incorporating these ingredients into your everyday meals, chefs can help create dishes that have a positive effect on their health. Don't have to tell the audience here the importance of a plant-forward, a truly balanced plate, focusing on, again, variety of seasonal vegetables, beans, legumes, nuts, whole grains, healthy fats, and lean proteins. And I just want to mention something about proteins and meats, because it's one of the questions I get all the time. I think, meat does have a role in our diet, not a starring role. That has been, I think, revolutionized by some of the data. But I also believe that when we're talking about farming and practices, regenerative farming and taking care of our animals prior to their sort of demise is highly important as we're sort of trying to balance and feed the planet that we live in. So our statement is this: eat more fruits and vegetables. When you eat meat, make sure it's good meat. Also, we're seeing an explosion, and this is really frustrating to some chefs, but some chefs really appreciate it. Learn how to cook various dietary needs: gluten-free, sodium-free, vegan, vegetarian, low carb. Offering these options to patients actually will help cater a broader customer basis. One of the things I've been fascinated about, and part of the reason why I started teaming up with a medically tailored meal company like Performance Kitchen, was that people are really customizing menus for specific health conditions. Now, for the doctors out there, I would argue that every single disease process out there that we deal with, from diabetes to cancer to arthritis, has a therapeutic diet. But unfortunately, we just don't prescribe it enough. For example, the DASH diet for heart disease, the gluten-free low carb for patients with celiac disease and diabetes, low FODMAP patients with IBS, autoimmune paleo, green autoimmune paleo for patients with autoimmune disorders, an anti-inflammatory diet, the mind diet for cancer and dementia, and overall the principles of the Mediterranean diet for all-cause mortality, including cardiovascular disease and diabetes. So these are diets that chefs really have a role in creating for our patients. And again, I mentioned before, particularly some of the work that I've been able to witness in the Netherlands, using and embracing social, seasonal, and local ingredients. Again, I love the idea of using what is grown on a rooftop, but in the Netherlands, as I mentioned before, I was just there, you have hospitals less than 5 miles from a farm. And I think that's a wonderful opportunity to start engaging the farmer in healthcare as well. And this is a movement called Farm to Fork. Again, sustainable sourcing of ingredients right down the block in the Netherlands, in fact, really is so crucial to the health of our planet, but also of our patients. And again, chefs really love to work on sustainable ingredients that are grown right down the block. So I would encourage people to go and talk to their local farmers and growers, because I think it's a missed opportunity if we don't. But one of the things I found was really fascinating, and a kudo. I love the chef at Leiden in Rotterdam, in the Netherlands. And you know, when I went there on a tour to identify best practices, they were doing it. Half of their menu was plant-based, and it was sourced locally and scratch cooked. And so I like to say that, you know, there's a lot of people doing the right work. But one of the things that we don't do is collaborate and share best practices. And so if anyone, particularly in the Netherlands, wants to know how it's being done the right way, I would actually urge you all to reach out to this amazing gentleman here and find out what they're doing here, because it is truly leading the pathway forward. And again, one of the things I believe is that cooking and this conversation should be fun. And that's part of the reason why I started taking doctors out of hospitals to teach them about nutrition and sustainability, taking them into a kitchen where they can actually talk to people that procure their food, make their food. And I think professional kitchens are an amazing educational resource that is untapped. So one of the things I recommend to people in the audience that want to get involved is actually reach out to a culinary school or a culinary program in your local neighborhood. And I can guarantee you that they have kitchen space available, and they would love to partner with you. Again, my goal is simple. It's really an aspirational goal here. I want to empower culinary professionals to make an impact in this space, in addition to our doctors and our dietitians. But partly because, again, the way what we're facing in today's world is a sensationalism by many influencers. And about 44% of people get their nutrition from the internet resources, not from us. And this is why people are confused. But I would like to share with you a little bit of the work that I've been able to, I think, accomplish in the last 5 years in changing the conversation, particularly here in the US, in the space of food as medicine. And so these are meals that I helped design a couple of years ago for a Cuban population in South Florida. Again, very attuned to racial and ethnic and cultural preferences when it comes to foods is highly important. And with your network, I think there should be foundational truths, but we should tailor the meals to the particular region that we serve. For example, South Africa, India, the UK, Latin America, American to a certain degree. We should be focusing on the healthy principles of, let's call it the Mediterranean diet, but offering their own flavors into what we're going to be prescribing to our patients in our hospitals. And again, I'll take the last 5 minutes maybe just to talk to you a little bit about the movement that's happening in the US. The food as medicine movement has been going on for a long time here in the US, but a couple years ago, the White House held a conference called Ending Food Hunger and Nutrition Security. And that really galvanized us here in the US. And Tufts put together this pyramid here. When it comes to medically tailored meals, right? What I believe is really the tip of the spear, partly because patients are so confused on what to eat, are what we call medically tailored meals. The idea there is that you give them meals that are already designed by registered dietitians, created by chefs, and prescribed by doctors. Transitioning them then now to a tailored grocery so they can be empowered through nutritional counseling and culinary education on how to cook, which again brings in the equation of produce nutrition programs. And then there are programs that our countries, our government supports, like SNAP and WIC, that offers patients with food insecurity and less income the ability to get some food into their diet, some real food into their healthcare. And so this is sort of the pyramid that we rely on, but I like to focus a little bit, again, the conflicts of interest. I am the chief health officer of a medically tailored meal company. But again, I think medically tailored meals have a really important role, partly because patients are just confused on what to eat. The science has been blown up on this. And so the question is this, at this point, how do we integrate food as medicine into healthcare? And again, the way I like this, Dr. Musafarian at Tufts really does a great job here, laying it out here. So as you can see, this is your standard clinical encounter. The doctor sees the patient, we do a social needs assessment, and then we prescribe them, yes, medications, but we also prescribe them food-based nutritional treatments and supports. I believe the first step should be a medically tailored meal, and then you transition them down to a tailored grocery program with produce subscriptions with concurrent nutrition and culinary education. Now, the nutrition and culinary education, I don't think can be done by one person. And that is why it's somewhat challenging that many, I hear from the dietetic world, the RDs want to have more culinary education as well. And part of the work that we're trying to develop is sort of this culinary medicine for all, not just doctors and dietitians. And what's fascinating about this whole movement is that when we look at health outcomes, it does increase health outcomes, decrease the cost of care, decrease healthcare utilization. And so for me, it's a win-win-win. The challenge is how to integrate this into conventional settings. This is some of the framework of food as medicine interventions published recently I think in Health Affairs, but by good friends here. Again, similar risk-related assessment by a medical professional, the standard medical interventions, but then again, looking at medical nutrition therapy by registered dietitians, providing them medically tailored meals through the lens of culinary medicine, especially as we transition from a meal to produce. Again, measuring what we do is so important, particularly in an evolving space, but I do believe that we will have great cost savings, increase revenue generation, and increase the quality of life, not only for our patients, but also for our food service providers. And again, I just want to conclude with some of what I believe will be the future. So we have healthcare on one side, we have food and health on the other side, and I think food as medicine is the prescription that we've been wanting to finally integrate into healthcare. And I just want to highlight some of the amazing work of some of the people that I have been truly shocked and impressed by. So as I mentioned before, it's greener by default. Kudos, tip my cap off to it. But I want to mention this nonprofit NGO called Eat This. It was on the behest of them that I just did a tour of the Netherlands food systems and allowed me to see where some of the gaps are, but some of the possibilities. Also, some of the work that you guys have all been doing at PON, the Healthy Hospital Food. What I hope to do here is give a different perspective. I have someone who's been in this space for almost 20 years trying to change the conversation. I feel that the two people that have been sort of left out of this conversation are our farmers and growers and our chefs. And I want to sort of just shout out to one of my brothers from another mother, Patrick Deckers from Caring Doctors, the founder of Caring Doctors. This man has dedicated literally his career and his money and his passion to changing how we feed patients in healthcare institutions in the Netherlands. And if you have the opportunity to take a look at this video, just because of our time, I don't have it, but I could actually also link it. It's through Eat This, it's on YouTube, and you put Caring Doctors and you will find this amazing 3 or 4 minute video that I encourage all of you to watch what's happening in the Netherlands. Oops, sorry about that. And so I just want to sort of wrap up a little bit here. Is that Food for Health Manifesto, again, this is sort of a written document that I have in my office. And it's a manifesto because it calls me to attention into what we're all trying to do. And in concluding, I just sort of share 2 things with you. And I believe by incorporating the principles of culinary medicine, chefs can not only enhance the health of their customers, but also elevate their own culinary craft, leading to a more innovative and health-conscious menu. Food as medicine interventions have the potential to improve health and achieve better health equity by working collaboratively with doctors, dietitians, and chefs. And I want to sort of sneak peek everyone on something that we're working on. Coming soon, we're going to be launching a culinary medicine program that I hope to be working with a lot of you in PON on building a hybrid online course that combines online learning materials similar to what you guys already have with live in-person virtual cooking sessions, where we offer a flexible approach to learning culinary medicine principles and cooking skills. And so this is intended to be a 6-week course where chef instructors and dietitians will walk through all nutritional theories, because it's also important to understand where patients are coming from when it comes to their nutritional theory. Also, practical culinary skills needed to promote healthy dishes and bespoke meal plans for both at home and in-person environments. I can tell you this from someone who's been in the space for almost 25 years, is that patients want to know how to cook, but then lean on us as healthcare providers working alongside a dietitian, working alongside a chef, and to prepare healthy meals for patients. And so, as I do with all my presentations, I like to close with my prescription for good health. When it comes to food, simply eat more plants, allow yourself 10 minutes a day to relax, move for 30 minutes a day, aim for 7 to 8 hours a night, and happiness is all based upon the communities around us that we choose to participate. Other people matter. And our motto is simple. When it comes to our health, it starts with food. But in the end, what we truly want in life is to be happy. And I'm so happy to be part of this amazing community. Other people do truly matter. And if you want to learn more about what we do and how we do it, take our free fresh guide, Fresh 5. That is where our new course, working with many of you in PON, hopefully will be developed. And if you want to learn more about my medical practice, it's called Fresh Medicine. And again, I love to be friends with all of you virtually, but hopefully someday we can be in the kitchen cooking together some delicious, healthy, plant-based meals. So with that, I will pass it back to Evelyn and stop sharing my slides.
All right, thank you very much, Robert. Thank you. There will be still, sorry, only virtual applause, but that's what we have today. And some more emojis, great. So everyone in the audience, if you want to, just also pose a live question, I think you can just raise your hand with the tool and then go for it. I will actually kick us off with a question I received before on Panko from Patrick Deckers from Caring Doctors. So I think he's in here live now, but you kind of also mentioned it, but I still want to ask the question. So he's asking, so he's also a medical doctor, and he's asking what will bring the necessary turnaround towards mainly plant-based? Is it either chefs that provide us with great and tasty menus, or is it healthcare professionals that educate about the scientific evidence of the planetary health diet? Yeah, well, listen, I think both are important. But someone who has, banged my head speaking to patients and administrators about the importance of a plant-based diet or planetary diet, I think we have to meet people where they're at. And I think the concept here, and it's a false narrative, that many people in today's world, particularly our colleagues in healthcare, more than ever, probably more than the patients that we serve, have this notion that plant-based meals don't taste well. And they're really bland and they're boring, and they're focused on health, not taste. And as much as we sort of convince patients to eat more plant-based, I think a chef, in the way they can actually promote taste and quality of ingredients, by feeding patients these healthy meals, will go a lot further than us, again, telling patients, don't do this, eat that. Again, the reason why I start off with the tobacco story is because for many, many years, the science was there, just like it is with healthcare and food, that smoking was bad for our health. And it wasn't until we had policy changes driven, not necessarily by doctors telling patients. It was really the people wanting a change. I think in food, you have a very interesting perspective. You have chefs that want to cook more healthfully for our patients and just have to have given the opportunity. Thanks. Okay, next one, maybe Joel or Joel, not sure.
Yes, hi, it's Joel. Thank you for the great presentation. One of the questions I had was around funding for infrastructure, and just to get your thoughts on that space. I know that there are a lot of great teaching kitchens out there, but a lot of them are endowment funded. this is this big challenge that you can talk with these institutions conceptually and everyone's on the same page, but there's this gap, I think, in them seeing the sticker shock of a capital investment. And I just wanted to get your thoughts on that.
Yeah, I think one of the things we have to really have a serious conversation, and some of the work that I've done in my consulting with healthcare institutions, is really, getting a true P&L of their food costs. And oftentimes, well, this is sort of a long conversation here, but one of the things, and we can actually follow up this because this is a really important factor here. Yes, so things that you mentioned there, you have to have sustainable funding. And one of the things I believe is to identify where gaps and losses are currently occurring. I can tell you this, globally, most of food served in our hospitals, I'm just going to be very frank, suck, okay? And we all know it. The patients know it, the administrators know it, the doctors know it. Not only suck, they're unhealthy. And identifying the cost of their current production and procurement and weighing that against the losses is really going to be the goal. Now, on top of that, I think we have a moral imperative right now when we are talking about how we are feeding our patients, our food is killing us, and then feeding the patients what we have in our hospitals are the same foods that are killing us. Some of the money that we're seeing happen come back to hospitals is example of what we showed at Northwell, going from a 3% patient satisfaction to 97% satisfaction. More money, you get more money per patient, at least in the US, per patient satisfaction scores go up. So there is an economic imperative. And I think the whole entire food as medicine movement has to have a business side to it all, unless we're just doing the right thing for the right reason. But without having that understanding of where the costs are happening from a truly financial point of view, we're never going to get to where we need to be. I love teaching kitchens, but they are not going to change healthcare the way they are being funded right now.
Great. Maybe Andrew, is your question yet unanswered?
Thanks, Evelyn. Hi, Robert. Nice to see you in the virtual again. The question has kind of been answered, and people are talking about the money. And in South Africa, there is an initiative within a private hospital where that is important. But I'm keen to work in the public sector space for the catering tenders, which are huge tenders. And I know the cost benefit of good reviews, how important that is, but what hard data have you got on savings? You mentioned costs per plate. I saw that on one of your slides. But have you got data on, for example, refrigeration is far heavier with animal-based cooking, refrigeration, transport, what hard data have you got, which would be important in that? And then have you managed to quantify the feel-good feeling that you've kind of pushed forward, that when people go to hospital, the main thing they talk about is the food, as you say. How was the food? And it's difficult to equate actual health outcomes to one or two meals in the hospital, but the long-term outcomes of changing behavior, have you got any data on how much actual traction you've got in patients taking healthy lifestyles to their homes and possibly within the medical profession? There is a hotel school within the state, which this could be taught to big numbers, which could go into hospitals. So that's another expense. You said the training and the off-site catering all are have cost implications. Thanks.
Yeah. So thank you for the comments, and I know there was sort of a bunch of embedded questions in that question. So I'll try to sort of tease some of these out. So I think one of the things I've shared with Evelyn in the past, there is an amazing white paper out there on procurement practices in the EU, which I'll be happy to share with everyone. And understanding the purchasing power of healthcare systems is something that we should be leveraging on. We are a massive, the health system is a massive procurement silo in healthcare here. A lot of money is being spent on our foods, not thinking about the quality of it. So particularly in South Africa, there is a lot of movement that's happening that I can actually I can talk to you offline about, that I am not allowed to say publicly yet. But you guys have an amazing culinary school there. You have a hospitality school there that I can tell you right now is very interested in learning more about this. So can I zoom in as a physician? Are you a physician? Okay. So a physician, oftentimes we don't talk to each other. So we don't go into the hospitality world. If you knock on that door of that hospitality school, all that culinary school, you trust me, they want to speak to us, partly because they want to understand the science behind what's happening, focusing more on the medical part of the culinary, as opposed to what we as physicians want to focus on, more of the culinary and less the medical, right? And I think this is where we have to start working together with people in the hospitality industry and the food service industry. Yes, there is tons of data in terms of reduction in cost when it comes to procurement. Again, I would shout out to Heidi. I think she's still on here from Greener by Default. The amazing work that they've been able to do, but also share some of that data that I did with them on cost per meal. I think as their sort of pilot study is going to grow to 400 hospitals, I think we're going to get a lot of data. The challenge is this, is that in healthcare, some of our kitchens are still from the 1950s, and some of them are as modern as of the 2000s. So looking at health systems, age of kitchens is the first step in this whole process. We can't have people, without an oven. I actually came across a hospital that does not have a working oven. And so think about that. How can we start cooking for patients without a working oven? And it tells you that they've been able to sustain themselves without an oven because they don't cook. And I can tell you this for sure. I won't mention what hospital, where country I was in, but those chefs and people in the kitchen wanted a working stove. So the first step I would do is this. If you can identify working with the procurement people of the hospital to better understand their costs, is the first step. Second thing is to really get a needs assessment of the quality of the kitchen that your hospital is serving. Number three, engaging with doctors, engaging with the food service people, the culinary schools, and the farmers and growers in your local vicinity. In the Netherlands, one of the things I came to realize is that those beautiful greenhouses grow a lot of tomatoes. And what I didn't see was in the hospitals, there was no tomatoes. There was no tomato sauce. There was no gazpacho. There was no red sauce. There was a lack of an opportunity using what they grow down the block into the hospital. Again, to give a concept of what's going to happen. The rooftop I did was not going to be a fully serving rooftop. Really, it was to bring people's attention to the movement. The last part I want to mention here is this. I don't believe that, and some of the people in the audience here know my feeling on this. It's a lot of work changing hospital food systems, and in the world that we're seeing today, when people are being discharged quicker, maybe that's why I ended my talk with medically tailored meals at home. Transitioning is an important thing that we all should be mindful of, because the opportunity, to your point, Andrew, to make that behavior change within that 1 to 2 meals in our hospitals may not be worth the lift. I do believe it is worth the lift, but if we're going to focus on changing health outcomes, that takes time, and that happens more in the ambulatory setting than it is the inpatient setting. So focusing on, again, the work that we're all trying to do in changing hospital foods, right, because it has to change, but also focusing on how the transition of care from inpatient to outpatient, because patients just want to feel healthier by eating the foods that we prescribe. And I do believe medically tailored meals is a good answer, but also with the culinary instruction and nutrition instruction to support that patient who is now not only eating the meal designed, but then now wants to get more empowered to cook their own meals.
Joel, again.
Sorry, this will be my last one. I just wanted to get your thoughts on and your experience when you have a country that has a top-down policy that really supports this concept in schools and healthcare and education versus countries that don't. And if you've noticed an impact or efficacy in either of those spaces.
Yeah, so totally. I think if we own the life as a country, as a government, we're more likely to protect it. I'm going to just highlight a little bit of the work that I think South Africa is starting to wake up on, but Abu Dhabi and Dubai is really I think going to be leading the force on this. So some of the work that I'm currently engaging with is the Longevity Center in Abu Dhabi. They're actually developing a medical center focusing on health, sustainability, and longevity, not only for patients, but the country. And if they invest, they're identifying if they invest upfront on the health of their nations, they're going to reap the rewards years, if not decades later. So there has to be an investment by the government in prevention in all this space. And that's why I'm still fighting the food fight, because we're seeing these changes happening in the US. We are starting to talk about how we should be focusing on a healthier food system on the front end so that we can prevent these chronic diseases that are afflicting our global society on the back end of it. So yes, to answer your question, people that invest upfront would get their ROI on the back end.
Okay. I think I would stop here. So I know we have some more questions in the chat, but I will just highlight that we can all again meet on Panko or individually wherever. So we ran 5 minutes over, so I think we should wrap it up. Thank you so much for having the time. And I think, as you say, I think it's a very great opportunity to have this very international exchange and to learn also from different countries where there are different regulations and dietary guidelines. But then also to really tailor it to the specific culinary needs and habits and tastes of each of the patient groups or environments. So I think we can learn from each other, but then still in the field has to be very specific. Great.
Yeah, I agree. I think that this is an important global movement, but action happens locally. And I think as a global society, I think what you've been able to do by gathering us is a first step on identifying best trends, best practices. But as some of the questions that I hope I answered, really the change is really local and micro-local and hyper-local in some instances. Yeah, happy to reach out to me if any other questions or follow-ups. I'm happy to answer any questions.
Great, thanks.
Okay, thank you.
Wonderful. Have a good day, Robert, and everybody else as well, wherever you are. Good evening or morning, and see you soon.
Be well.